And so we have a good recording of this. So I've got, what, 7:32. Lori, would you like, before, I guess I can just tell us a little bit about, I think we have a few visitors. Tim Porter, nice to see you. He's one of our newest members.
Thank you.
Orthopedic Outfitters supplies PPE, and glad to have you with us.
Thank you.
And I think there may be some others. I can't see any new faces, just some names. So welcome to our 2025 forum. And this committee is open to the public. Anybody can join us, and we try to bring in speakers that talk about our vision document that we recently updated for 2025, and to make sure we're working on our goals that we've set for the chamber and the community. So we're just pleased to have our guest speaker today, and I'll give Lori the opportunity of introducing him.
Great. Lori Moffett-Felberg, Senior Principal with Dahlin Group Architecture Planning. Welcome, everybody. I'd like to read a short bio that Rick has provided for us. So Rick Shumway, a nationally recognized results-driven healthcare executive. Rick is the president and CEO at Stanford Care-ValleyCare, which is a comprehensive health system that is a key part of the Stanford Healthcare. With its base in Pleasanton, it serves a large portion of the East Bay and is home to a range of both complex and community-based healthcare services. Rick has spent the majority of his career in large academic medical centers and has worked hard to integrate these systems directly into the communities that they serve. Prior to joining Stanford Care-ValleyCare, Rick served as the Chief Administrative Officer, the lead executive position at the 780-bed University of Cincinnati Medical Center. UC Medical Center is the only level 1 trauma and academic medical center within the greater Cincinnati, Ohio region and the surrounding tri-state area. Prior to his role in Cincinnati, Rick served as the executive director at the University of Utah in Salt Lake City, Utah, which is comprised of 4 hospitals, 12 community-based clinics, 1,200 board-certified physicians, and 9 He has also held senior leadership positions at the University Medical Center in Pittsburgh, University of Washington Medical Center in Seattle, and the Intermountain Healthcare's Utah Valley Hospital in Provo, Utah. You've been busy. Rick resides in Denver with his wife, Sarah, and is a father to 3 active boys. In his spare time, which he has none of, he enjoys spending time with his family and takes advantage of the beautiful California weather to fish and camp wherever he can. I'd like to just put a plug in for Stanford Valley Care. We live in Pleasanton, so it's our family's hospital, and they're doing an awesome job. So we're thrilled to have Rick here today. And I'm going to turn it over to you, Rick.
Well, I appreciate the introduction. Somebody wrote that made it sound better than I would have. So I appreciate the introduction. And I always feel like anytime I'm in front of the Pleasanton Chamber, it's a little anticlimactic, given that you get to work with Tracy Lewis Taylor on a regular basis. But I'm pleased to be with you. She happens to be next door to me right now, so I do feel always interesting that we're logging in, but we can't sit 6 feet apart if we're in front of a computer. So you'll forgive us for being in our separate offices. Let me see if this screen share works. Hang on 1 second.
Thank you.
There we go.
Now can you see that?
Yeah.
All right, perfect. So I am, I appreciate the opportunity. And Steve, remind me, so do I have like half an hour with questions or yeah. I think you said 30, 40 minutes with questions?
Yeah, just about. Yeah, that works. Yeah. Okay.
So I'll get through this as quickly as I can, because this is certainly the topic du jour, I think, for so many reasons. And I think it's obviously very relevant from a chamber perspective, from a city perspective, from a region perspective, just given the fact that so much of what the future is going to look like going forward is being shaped within, I would say, the healthcare and the public health industries. And so there is certainly a large portion of what the basis for decisions are on the county level that is actually based on a lot of the things that we're doing here. And so I think it's important for all of you to have sort of a context and a backdrop for what is going on within the community and within the region to address some of those needs so that we can safely continue the development and reopening of our region. So I appreciate the opportunity to spend time with you all this morning. I also appreciate Steve's thought around how to articulate this around myths and facts. I certainly, as I've spoken in different groups to different people, have talked about these things in different contexts, but I think it's actually really important to parse it out with this myths and facts idea, really because there is so much information that is out there, and there is so much sometimes conflicting direction that you see and you hear and you feel. And so hopefully this gives you a little bit of context for what's actually happening here on the ground and what we're doing to ensure that we're playing our part in, again, supporting the region as it continues to grow and develop post-COVID pandemic. So looking forward to having this conversation. So I'm going to dive right in. I think there are a few things that I think are of interest to this group and to many others. And some of this, again, you may be familiar with it, some of it you may not be. So the first thing that I wanted to address was this idea that transmission of the virus is limited to individuals that are symptomatic, or a certain group of people that may or may not be spreading or transmitting the virus. You know, the reality is that this has become a global pandemic for a reason. And one of the things that we do know about COVID-19 is its transmittability is pretty high, higher than the flu, higher than some of these other infectious diseases that we have. And so it's moved pretty quickly around the globe. And not only that, as we've learned more about it, it's become very clear that, again, despite the World Health Organization coming out this week saying asymptomatic carriers don't transmit very easily, and then quickly reversing that within 24 hours, what we've learned is that the transmission of this can be by anybody who has it. People that have symptoms, people that don't, people that have it and are going to get symptoms within a period of 2 weeks. So the reality is that it is a significant threat from a movement standpoint beyond some of these other infectious diseases that we know about. One thing I will say very directly about COVID-19 is that it is a very dynamic learning process. We are continuing to learn more about this disease every single day. And there are still many important questions that remain unanswered. Everything from if you have had it, or if you have antibodies that say that you've had it, are you immune from the disease going forward? The answer to that question is we don't know. We think maybe, but I think there's still a lot of information that needs to be defined. I think there's obviously a lot of work that's going on around vaccine development and the management of that process, and it's rapid fire. Most of the time, vaccines take years to develop and prepare for sort of mass distribution, and we're trying to condense this down into a matter of months. And so there are still a lot of major open questions about COVID-19. In the meantime, while we're trying to find answers to these questions, I think we just continue to follow this public health guidance that we have around preventing transmission, hand washing, covering mouth, don't touch face, mouth, nose, or eyes, stay home if you're sick, wear face masks when in public places, etc. These are all the things that we know we should be doing, and hopefully out of this pandemic, this is a good byproduct of this, is that all of us become much more vigilant about managing any infectious disease by following these guidelines. So that for sure is a myth that only people with COVID-19 symptoms are capable of spreading the virus, and something that we'll continue to move forward on. Steve, how do you want to do this? Do you want me to just stop after each one of these and see if there are any questions?
Sure. Yeah. I mean, I've got, if anybody does have a question, they can type it in the chat and I can bring that up accordingly. But that's fine if that,
Okay.
that'll work. Yeah.
Okay. Are there any questions about this particular myth or things that surround it?
I have one question.
Yeah.
How many COVID-19 patients did you have at ValleyCare?
So one of the things that I can tell you, and I'll get to sort of our capacity here in just a few minutes, is that the county, Alameda County, is the entity that has asked to be the reporter of which patients are where. So they've actually asked us not to publicly disclose the number of patients that we have or haven't had. They want to be the ones to be able to put that out. And what you can actually do is you can go on their website, and there's a link there, and it shows by city how many COVID cases there have been with some additional data points. So if you're interested in what's happened in Pleasanton, Livermore, Dublin, Danville, San Ramon, essentially our region, there's really good granular data there, but they've certainly asked us to let them report specific data points about that. So it's a great question. I am going to address that in just a second generally. So, but I think it's an important point for our community to know. Any other questions on this piece? Okay. So I am going to move on to this next slide. So the second myth or fact is the hospital is prepared for a large surge in COVID-19 patients. So this is absolutely unequivocally a fact. We have had a number of opportunities to really build up our infrastructure to ensure that we are well prepared for, and when I say a large surge, I mean a really large surge. So when we had shelter in place that went into effect months ago, one of the things that did was that allowed our hospitals regionally and from a state perspective to get a little bit of a head start. So we didn't become New York City. And I think that was a really important moment in time from a hospital perspective, because that earlier intervention allowed us to prepare for what was potentially going to be a large surge. There were a number of things that we did in that preparation process. So at the very beginning of the pandemic, one of the things that we did was we stopped doing elective procedures, elective healthcare, and we really limited our services to urgent and emergent services within the hospital. And that was really in an attempt to free up capacity in the case that there was a surge of COVID patients, so that we didn't have a big issue to find space for people that might need it. And so we went ahead and did that, and that was a really important step. In fact, at the time, the California Hospital Association asked all hospitals to put together a plan where they could surge 40 to 50% beyond their very top capacity. And for most hospitals, we've never been asked to do that before. That's a pretty significant number to put into play, and so that was an important ask early on. Again, what I'm really proud of is that throughout this process, our teams really came together and we built what was essentially a 4-phase surge plan that not only allowed us to meet the California Hospital Association requirements, but we can actually surge up to 70% beyond our top capacity. So our community and our region is in really good shape from an ability to have healthcare flex the way that it needs to flex in the case that we have a large number of COVID patients. So the question sometimes comes up, well, what does that mean? What does it mean you expanded your capacity by 70%? In the most rudimentary terms, we could see 70% more patients in our infrastructure than if we were absolutely full. That also means that we had to add additional infrastructure to be able to do that. So one example is isolation rooms. So when you go into a hospital, you have an infectious disease of some sort, many times they'll put you in an isolation room. It's not as bad as it sounds. for those of you who may or may not have been in one of those. All that means is that we have ventilation in that room and air handling systems and filters and so on to ensure that the things that you're breathing in and out are actually not spreading throughout the rest of the hospital. So that's what that means. And so what we were able to do is go from, at ValleyCare, we went from having somewhere in the neighborhood of 8 isolation capable rooms, which is appropriate for the hospital, a hospital of our size, up to 54. So we actually increased our isolation capability exponentially. We also increased our intensive care capability exponentially at the same time. We know that COVID inordinately impacts individuals that are over 65, and if they're hospitalized, many times they require ICU care. And so one of the things that we required was expanding our ICU capability as well. A lot of the news stories that you heard early in the pandemic was about a shortage of ventilators. I'm very proud to say that our teams came together and we have a really significant supply of ventilators. So again, to match that 70% surge capability, we had to increase our ventilator fleet, and we were able to do that. And I think we're in really good shape from that perspective. We also put together a staff plan, a physician plan to ensure that we have the people to surge to that 70% capacity. And then another thing that you'll hear about pretty regularly is, do we have enough personal protective equipment? And again, our teams just came together exceptionally well, along with our community. Our community donated quite a few items of PPE, put us in a position where we were never in a position where we were asking our staff to do anything that was unsafe. They always had access to fresh PPE, and so did our patients, and they continue to do so. And unfortunately, that has not been the case, even in our region, where there are other organizations that have had a tougher time getting access to some of this personal protective equipment. So we're very fortunate that the teams were able to come together and do that. And then certainly we put together our protocols to ensure that we could surge quickly up and down. I'm going to end with this, and I'll pause for questions on this. The State Emergency Operations Center requires us to submit these plans to them. And one of the comments that they made early on and all the way through the process is that ValleyCare has been one of the most prepared organizations that the state has worked with. And so I'm really proud of, again, I keep saying the teams, it literally has been hundreds and hundreds, thousands of people that have come together to put us as a community in a position where we're able to surge and we're able to respond quickly as we need to. So I'm very, very proud of that. So again, happy to pause here for a second and take any questions on this specific issue and anything that might come up on this one. Otherwise, I'm happy to move on to the next.
I had a question, Rick. Thanks for coming today. This is Herb. I know there's sites out there that show cases and they track cases by cities and all that. And you know, with worldwide with the 90% recovery rate, which is great, but we don't have anything that tracks the capacity by hospitals to show, you know, that maybe some of these cases aren't even coming in. And you guys, as Tracy said once, we're open for business.
I'll send the same message here in about 2 slides.
Okay, thanks.
No, I'm with you 100%. So what you see on the Alameda County site is one of the metrics that the state and the county have said unequivocally are indicators to whether or not we can open, and that is percentage of hospitalization. And that's one of the primary baselines. So you can see that by county, you can see it by city, you can see it by state. There's another website, and I'll pull it up here and give you if you're interested. Hang on. Good thing this is why it's good to be on the computer. If you go to covid19.healthdata.org, that is one of the primary models that is being used to ensure that people know what the hospitalization capacity is by state and by region. So you can drop down to California and you can see on one of those graphs what the needed hospital beds are and what the occupied hospital beds are. And there's a big gap between those that shows California is actually in pretty good shape, both from a regular hospital bed standpoint, but also from an ICU hospital bed standpoint. So great question. And again, I'll get to our capacity in just a second here, because that's continually an important point. So I'm going to this next, here it is, I guess. You didn't have to wait very long. So myth or fact, Stanford Healthcare ValleyCare is or has been at max capacity with COVID-19 patients or other patients. So there are a few things that I will point out to you. Hospitals are unequivocally some of the most prepared environments to manage this infection. And I'll talk more about ways that we're doing that at the hospital. But very directly, I have to say, our local and regional hospitals have absolutely not been overrun with high volumes of COVID-19 patients. There is significant capacity left at ValleyCare, and I'll just say other hospitals' names, San Ramon, John Muir, Washington, Alta Bates. None of them have been overrun with high volumes of COVID-19 patients. And so that's good news. Again, there's no way we wanted to have the New York experience in this context. But the reality is our hospitals have been well prepared and again, have a lot of capacity. So that's a general answer to the questions that you guys have been asking. How many patients has ValleyCare had? The answer is we have had patients. The other part of that answer is it is not overrunning our hospital. And we have a really, really good way to manage those patients. And I'll talk more about those. And I think that's really important. The other piece here that I'll talk about is, unfortunately, patients have been delaying necessary care because of a belief that there is a significant number of COVID-19 patients at the hospital. I'm here to tell you that we are safer than any place that you can identify that it may be opening as part of the phased plan. So we'll talk more about this. And I wanted to hit on that for just a minute. So this is another myth or fact. Because of the concerns about COVID-19 patients at the hospital or clinic, I should delay my care as long as possible. And I can tell you that this is 100% a myth. One of the staggering statistics that I have seen recently is 48% of United States citizens have delayed medical care during the COVID-19 pandemic. And what I'm very, very concerned about is the concept of what things are going to look like in the next 12 months because people were not able to get their cancer screenings done, or people didn't manage their diabetes in a way that was necessary. We are seeing very acute negative clinical outcomes. And while I misspelled anecdote on that second bullet point, I can tell you that we have seen example after example after example of this in our emergency room, where and I can give you a couple of those examples. We've had people that have come into our ER that have been sitting at home with chest pain for 5 days and have had to have major acute intervention that absolutely could have been avoided. Heart function that will never come back because they waited in their homes and didn't seek care. We've seen people that have had stomach pain that had partially ruptured appendices, turned into sepsis, went to the ICU here for weeks and weeks and weeks, near-death experience type things, because they didn't want to come in because of a perception that we are overrun with COVID-19 patients and this is a hotbed and they're going to catch COVID-19 if they come into the hospital. I have to tell you, I couldn't say it any more clearly. The hospitals and clinics are ready to take care of you and your family members and your friends in the safest way possible. And so the plea that we have is come in and get your work done, get the things taken care of that you need to. Don't delay these things because we are ready and able to take care of anything that comes in the door. Frankly, the only thing that we're not doing right now at the hospital is cosmetic surgery, and that's it. Everything else that you can think of that we've done before in the hospitals and clinics is underway. We are back in business. So I think that's an important piece. You know, this is another thing that I think is pretty critical as we think about what's happening in the industry. I keep saying the words, the hospital and clinics are safe. Please come. And I'm here to tell you why that is. I think that's another thing that's important, particularly as we try and manage these unintended clinical outcomes. There are so many things that have been put into place here at the hospital to ensure that we are managing any potential transmissions to the very best of our ability. So a few things that you might not know that I wanted to share with you in terms of what we're doing. So we are screening and testing patients for COVID-19 as appropriate in advance of any admissions, any procedures that you would have, or entry into the hospital. If you're coming in for knee surgery, one of the things that you will do pre-procedure is get a COVID test. We will make sure that you don't have COVID before you come into the hospital. And I think that's an important part of the protocol. And again, unfortunately, for some organizations, access to testing capabilities is still an issue. And I think we still watch that very closely. I'll talk about testing in a minute here. But the reality is we are in a position where we're able to test all of our patients. And I think that's really important. If you come into the hospital, you'll see all of our patients and all of our healthcare workers masked. And I think that universal masking protocol has been essential, and we've actually had that in place for some time now. And I think that's important. Also, if you walk into any of our entry points, all individuals entering the hospital environment will be screened. You'll have your temperature taken, you'll answer a series of questions, and if any of those trigger points get tripped, we'll have other discussions with how to proceed and otherwise. So we're managing flow into the hospital as well. We're also co-locating COVID-19 patients within our hospital. So they're not spread out all over the place. And so if you come to the hospital, the likelihood is you're not going to be in a room next to a COVID-19 patient. We have them located in a specific area of the hospital so we can manage those protocols effectively and efficiently for those patients and for the other patients that are in the hospital. I think that's an important piece of this. We've also increased the monitoring of COVID-19 nasal swabs and antibody testing for all of our healthcare workers. So all of our teams have been tested and have also had serology antibody tests. Again, something that most organizations are not able to do given the challenge with the test kit supplies, but certainly with the antibody tests, that's a very unique opportunity that we've been able to provide for our healthcare workers. Every day, multiple times a day, we symptom screen our healthcare workers as well. There are county guidelines, there are Medicare, Medicaid guidelines that we utilize to ensure that our staff are feeling well throughout the day, and then we're not just letting people circulate within the system. We also are maintaining this robust supply of PPE, and we're ensuring that it's utilized appropriately. Again, hard to manage an infection when you don't have the appropriate PPE. And so I'm very, very pleased with the work that our supply chain teams have done to ensure that we have access to those things. We're monitoring the disease in the community on a daily basis. As things change, we're able to flex up and flex down as necessary. And so, as I said, we are in constant contact with Alameda County. We're very tight with them these days. And so I think that's an important distinction as well, is that we're able to maneuver as we need to as things move. And then finally, we have continued enhanced disinfection protocols. They were already pretty good at a hospital, as you would expect, but we've even ramped them up further. So I think that's a really important piece. I think my last couple of slides are around testing. So let me just hit those quickly. You can be tested for COVID-19 at Stanford Care-ValleyCare. The answer is yes, that's a fact. And there are two ways that you might be tested. So I'm going to call one internal testing, So if you're in the hospital and you're receiving care here, you would receive an internal test. And there are two ways that that happens. So we have the regular PCR nasal swab test that goes up your nose for those of you who have had the pleasure of having that test. And one of the amazing things about being part of the Stanford healthcare system is that early on in the pandemic, the turnaround times to send these labs to the county or to other external labs sometimes was 7 to 10 days. So we could potentially have been waiting for a week for a result for somebody who was under investigation for COVID, which meant that we had to treat you like you did have it and be in isolation and all those things. Early on, Stanford developed its own test, and we were able to get those results within 24 hours. And that continues to be a real blessing to us and our community to be able to have access to quick test turnaround times so that we can make decisions and move forward. So I'm really, really pleased with that. We've also gotten access to even more rapid turnaround testing. We've been able to acquire here at Stanford Care-ValleyCare what we call our Cepheid testing unit. It's a 45-minute test, so it's a little more acute and urgent, and we're able to turn those tests around very quickly, and we use those in a protocolized manner. We do have access to the other tests that you hear about on the news, the 5-minute turnaround times, but those actually have had some false negative rates that you might have seen on the news. And so we have not been using those. They've not been in circulation. We continue to have a testing task force that evaluates all the different testing capabilities to ensure that we're putting into place ones that are reliable and otherwise. Another thing that you've heard about quite a bit is the antibody testing. Again, early on, Stanford developed an antibody test of its own. It was one of the first in the country to do that and made that available to all patients within the Stanford healthcare network. It requires a physician order. And it's also been administered to Stanford Care-ValleyCare staff and physicians. The tricky part about that serology test or that antibody test is, as I said at the beginning, we're still unsure about what it means to have antibodies. So are you immune? The answer is, again, we think so, probably, but there's still a lot of work that needs to be done. So there's a reason why that's not a broadly disseminated test across the general public at this point. But our Stanford physicians are certainly using it as they see fit for the care of patients. The other way that you might be tested internally is you might be asked to go through one of our drive-through testing sites. There's one here on the main campus, and there's also one over at the Cancer Center on 5725 West Las Positas. Again, if you're coming in for a procedure or otherwise, if you've seen your PCP and you're symptomatic, you would be sent to one of these sites with a physician order. And so those are some of the ways that you can be tested internally. Last but not least, we're also, as you know, working closely with Pleasanton, Dublin, Livermore, and the Fairgrounds to operate the external testing site. It is a key metric for the governor and public health officials. And a couple of weeks ago, the overall number of tests that were being done in Alameda County overall, a third of them were being done at this test site. So the idea that we actually have in our community something that is having such a big impact on our ability to move forward with this is really, really important. So I think that's a key piece. We continue to work closely with the cities. We have the county engaged now, and so we're working with Supervisor Haggerty and the Public Health Department and others where the county is actually engaging with us in addition to our local region. So that's been a very positive move as well. And so we're going to continue to do our best to operate that site in a consistent manner so we can continue to serve the needs of the community.
Rick, I'd just like to say at the fairgrounds, that's a great service. My wife and I went through, and it was just outstanding care. The people were quite pleasant, took care of us quickly. We were in and out of there in less than 10 minutes.
That's fantastic.
That's a great service. And we got the results in about 4 days.
Yep.
Yep. Thanks for doing that.
I appreciate that, Brad. I think that it has been and I'll just say this because this is the group one of the groups I would say this to. I think this is such a great example of how we are coming together as a region to lead with a variety of entities. And I think that's been something I've been super impressed with as I've entered this area, is our commitment to the Tri-Valley and making sure that we are collectively doing everything we can to advance our region. And I think this is a great, just tangible example of how that can work. So I've been very fortunate and honored to work with our cities and our county, and I think we're moving in the right direction. So that's all positive.
Rick, a couple questions in the chat.
Yeah.
Vera was wondering, and I'm not sure if you could share this, what the results of your employee antibody tests are, like percentage, positive. Is that something you can share or not?
So what I'll tell you, I can't tell you the percent, but I can tell you it is, let me think of an adjective here, exceptionally low.
Okay.
Exceptionally low. So I'll leave it at that. But again, I think it's an indicator of how well we have been able to put our people in a situation where they have the adequate protection that they need. Again, whether that's PPE or protocols or otherwise. So it's a great question. The rate is very, very, very low.
Another question Joe Foose asked, it's a long one, but I'll try to simplify it. His company's developed an app that helps people feel more comfortable coming to work. And he's wondering, if people use that, will they be less likely to wear masks and wash their hands? Do you see any problems with apps like that give some false sense of security for workers?
No, I think a couple things that I think the county has been so explicit about the health orders related to what employers have to do to open up. And so I think the inclusion of things like masks, temp checks, those kinds of things, I can't see those going away for some period of time in terms of, I'm talking just health orders. So, related to what's going to be required of all of us. Now, is everybody going to be compliant? I suppose there will always be a contingent that's not. But my guess is the general public is very interested in opening quickly and safely. And so if one of the parameters of that is that you need to wear a mask when you go into a store or those kinds of things, I think that's going to continue along the way. So employers I think are going to continue to have more focus on this by necessity.
And Herb asks, he looked at the website about the hospitalization capacity, and it doesn't really show local geographic areas like Tri-Valley versus Oakland, for example. Wouldn't it be helpful to have that listed so it would maybe help us open our businesses sooner?
It would be, and it's interesting. I'll mention a couple of things on that. What we know is that when we look at Alameda County, that has now been identified as the problem child in the Bay Area. It used to be Santa Clara. Now it's Alameda. The primary areas where that is happening are in Oakland and in Hayward, are the two areas that's primarily being driven by. And that's a big problem, actually. I mean, that's something that's going to have to be really supported, and resources are going to have to go towards that and otherwise. But we're not seeing the same rates in the Tri-Valley. And I think all of you saw, many of you probably participated in supporting the letter from the mayors to the county over the course of the last week around looking at the Tri-Valley a little bit differently than maybe we're looking at over the hill there. And so I think that's going to continue to be a dialogue that we're going to have, is what needs to happen for our region. And again, I'll just say, even though the mayors put it in their letter, the rates are exceptionally low from our county testing site on this side of the hill. So I think it's something that we're going to continue to promote and support in terms of, acting as a region. Principally, it's similar to what the counties all did at the beginning of this and trying to have a comprehensive approach. If Danville, Walnut Creek, Alamo, San Ramon are doing something and we're doing something different here, that's a little bit of a challenge. So I think it's an ongoing discussion, but there have been pushes to the county to deal with that specific issue.
Good. Nathan asked kind of a personal question for you, Rick. Are you planning to travel or go on vacation in the next few weeks, or is it still too early? And how about dining? Are you ready to go dining at a restaurant in Danville? Because they can do that.
Yeah, let's, so I'll answer the personal question. I just got back 2 nights ago from a trip, actually. I went out to see my family in Salt Lake City. And I can tell you that the protocols in the airport are pretty good. I think that the management of that travel process has obviously evolved as well. So the answer you personally, yes, I have been on a plane recently, and I think that was managed reasonably well. And I personally would go and I'd socially distance, and I would follow the rules and the protocols. But yes, I will probably go to an outdoor restaurant in Danville when they open up.
Great. Vera just wanted a comment she made about the positive antibody testing you talked about at the hospital for your employees. Wouldn't it be a good tool to share that to the public so maybe they'd be more willing to wear the masks to prevent that from occurring? And, again, just a point of maybe sharing that information if possible.
Yeah, I totally get the context and the concept. The challenge with that, again, is what's the message? So the message is we have a really good understanding of how our employee population looks, but continuing to explore what that means is something that we're pretty committed to. So in speaking with the public about, that particular item related to, opening and mask wearing and those kinds of things, I think it's still maybe a little early until we know more about what that antibody test means. But it's certainly something that we're continuing to focus on and learn more about.
Herb just posted, did the protests and non-social distancing affect hospitalization capacity in the Tri-Valley negatively due to COVID?
I will tell you there has been no material change at this point in hospitalization capacity. Now, the other thing that people say, almost tongue in cheek, is we'll count down 14 days from about a week and a half ago, and let's see how that evolves over time. As of right now, there has not been a material change in the capacity of the hospitals in the region. And so I think we're watching that very closely and trying to engage. And this is part of the challenge, is trying to engage now protocols where to say things like, if you were at a protest, come get tested, those kinds of things. So I think we're trying to be creative about how we manage that and how we do that. But yeah, it's something we're watching day to day to make sure that we're ready for it. But as I said at the very beginning, we're ready for this. So if there is more that comes, we will certainly be prepared with our surge plans and otherwise.
That's all I have in the chat right now. So.
All right, this is my last slide, and then I'm happy to take any other questions. Sorry, my things are popping up there. So a couple things that I just want to close with. Again, I think this is so important related to Stanford and your community. Sorry, am I blocking you guys with that? There we go. Stanford Care-ValleyCare is participating in COVID-19 clinical trials. So this is really super, super exciting. COVID-19 was the impetus for a lot of things. But one of the things that it really changed was the ability for Stanford Care-ValleyCare to access cutting edge clinical trials around treatment for COVID-19. So the first trial that we participated in was the Remdessavir trial. So many of you have read about Remdesivir. It's one of the primary treatments that's been approved for the treatment of COVID-19 patients. We were one of 54 clinical sites in the world here in Pleasanton that were approved by the National Institutes of Health to participate in this trial. So our patients had access to the cutting edge treatment before the cutting edge treatment was even available to the general public. And I think that that is something most people don't know, but it's something that we're exceptionally proud of. And we're actually in the process, we've launched another 2 clinical trials related to the treatment protocols for COVID-19. And so again, this is a perfect example of Stanford in our community, is having access to this kind of research, and I should even just say bleeding edge technology and access to things that are you couldn't find unless you were in Palo Alto. And I think that that's really exciting. So I thought that was a good thing to close on in terms of updates, because it's such a positive story. And again, I'll close by saying, and then answer any other questions that you have. I just have to tell you how appreciative we are of the support that we feel like we've received from our community during this pandemic, and previous to it for sure, during absolutely, and it continues. And so we're so honored to be a part of this community, and look forward to good things ahead. I think we're moving in the right direction. So again, happy to answer any questions. I'll stop sharing, Steve. And
Yeah, there we go. Good, perfect. I have a couple, but I'll leave it up for others. Anybody want to raise their hand for a question, and just make sure you unmute yourself. Any questions? So
Yes.
go ahead, Lori. Sorry. Yeah.
Yeah, real quick, and I would put this in the chat, but I'm going to babble here for a minute. And this doesn't really affect Stanford Healthcare, but because you've worked across the country and you have a national perspective, we're starting to read things about the smaller rural hospitals and the shutdown of elective surgeries, things like that, really impacting them from a financial standpoint, and the risk that they're running for becoming insolvent. From your perspective in healthcare administration, is that something that we're going to face nationally, do you think, or do you even have a perspective on that?
Thanks for asking that question. I think that you said it doesn't affect Stanford. It absolutely does. This has been hopefully, and I always tell people, this has hopefully been a singular experience that the healthcare industry goes through in its evolution. The financial impacts to the healthcare industry have been absolutely devastating. And when you think about what that meant to turn off any and all elective, semi-urgent work, it's just like any of the businesses that you support. The revenue stream changed dramatically overnight almost, and the costs that healthcare systems had to bear to get ready and to do all these things went through the roof. And so that's really not a good recipe for financial solvency. The statistic I always tell people, if you look in California, prior to COVID-19, 40% of hospitals were losing money. The rest of them, if they were making a margin of 2 to 3%, were in reasonable shape. And so overnight, every single hospital in California lost substantial revenue. And to answer your question directly, I think there are going to be significant impacts in the communities with these hospitals that were already struggling and continue to struggle. And I think there are going to be consolidations. I think some are going to close. I think that this is going to be an ongoing effect that unfortunately this pandemic has had. I will tell you, ValleyCare is not immune. We certainly have had our significant financial hit, as has Stanford Healthcare. But what I can tell you is that going into this pandemic, we were on pretty solid ground. And so we will get through this. and we'll end up on the other side. But it's a great question, and I think the healthcare industry is under pretty significant duress right now. It's why you see these CARES Act dollars that are being distributed to hospitals so that they can get through this, period of time. But even those dollars, they don't come anywhere close to covering the losses that most hospitals and health systems have borne during this period. So great question. I wish I had a better answer, but it's going to be an interesting year. I think we'll know more over the next 12 months.
Rick, a follow-up.
The ValleyCare is here to stay, so we're good.
Rick, a follow-up to that question. Did ValleyCare furlough any medical or administrative personnel? And if so, have they now been brought back?
So we did not furlough as part of this process. One of the things that Stanford Healthcare at large did, and you may have seen some of this in the news, but one of the things that we did, we call it our temporary work adjustment program. And every employee at Stanford Medicine had the option to do one of two things. They could take a 20% decrease in pay and continue to work, or instead of doing that, over a 10-week time frame, everybody had the option to take 12 days of paid time off. And so what that allowed us to do was maintain people's paychecks during this period of time and really avoid doing mass layoffs and those kinds of things. And those are really the two principles that we operated under. So we are probably 2/3 of the way through that process right now. And I think that's going, again, pretty well. One of the things that you may have seen is that we did make the decision to close our skilled nursing facility in Livermore. That was not related to, that was not a decision that was driven from a financial standpoint. That was very much a patient safety conversation. So as the pandemic unfolded, and as you've seen, those congregant living situations for the highest risk population are super risky. And one of the things that we decided early on was that we would limit admissions into the skilled nursing facility to the point where on April 24th, that was our last patient in the skilled nursing facility. We haven't had patients in it since that point. During the course of the last month and a half, we really made the decision that rather than reintroduce that high risk environment back into the community, that for the sake of our patients and for our community, we would revamp our protocols internally. We would keep those patients maybe a little longer in the hospital in that really controlled infection control environment. And then when they were either ready to discharge to home, or we worked very closely with our preferred provider network of skilled nursing facilities, that we would move them to that place. So it was really a decision around patient safety, not related, Brad, to making a decision that financially we needed to, eliminate a number of jobs.
Thank you.
Any other questions?
I
from
just
anybody?
had one that I keep getting. I know that everybody says we need more testing. What's the time frame they are going to keep Alameda County testing site going? And Brad, I'm glad to see the unskilled nursing home you're in right now is working out for you.
Hope you get to be as old as I am.
I want to be like you when I grow up, Brad.
So the intention is to continue running the site, and the county over the last number of weeks has really entered the discussion. Again, given the percentage of the testing that we represent at this site, it's very important to the county. So we are working with them on some additional protocols there. We intend for that to continue over the coming weeks. There is a potential that we might have to pause for a few days while we re-articulate some lab protocols, but the general idea is to continue to operate that while we get through this portion of the pandemic. So, and it's been pretty consistent. I mean, every day we're doing somewhere in the neighborhood of 200, and we end up closing at like noon or 1 every single day. So I think that's something that we're trying to figure out the last details, but it looks, signs are positive. How's that?
I've got one other thing to ask, Rick. Obviously, Stanford ValleyCare is very important to Pleasanton and the Tri-Valley area. Are there any other things that the chamber board can do to help support your organization, whether it's through this time or just into the future and just in general? Is there anything else that we can do to support your efforts?
I think, yeah, I really appreciate that. I think getting the word out to those that you interact with, that as we talked about today, that we're in pretty good shape in terms of being able to take care of people in this really unprecedented time. And that, again, we're really attempting to try and not have these really negative clinical outcomes that we're starting to see more of. And so just sending the message, please come when you need to come. But don't come unnecessarily, of course, but we want to make sure that you're getting care when you need it. So I would say that would be important. The other thing I'll just leave you with is, while we're certainly looking at the present right now and how we articulate to be successful in the future, many of the growth and development plans that we had in place or ready to launch are still underway. So one great example of that is we just hired here one of the most prominent heart surgeons in Northern California in the Department of Cardiothoracic Surgery at Stanford, who is exclusively dedicated to Stanford ValleyCare. We're working on another recruitment for his partner, and that really is a great example of bringing super Stanford expertise into our community that's committed to our community. And so as we build those programs, I think that the chamber, anything that the chamber can do to help support, those growth of those programs, and even some of the, word of mouth and advertisement of those programs, we're happy whenever you guys feel like it's appropriate to have those individuals engage with you in any way. But it's exciting times. What I tell people is I have a literal list of 27 high-end clinical programs that are in some stage of development that have not existed here in our region in the way that they will in the future. So I think that's a super exciting development. It's this idea of I love Palo Alto, but let's keep you out of there as much as we possibly can and be able to stay in our community for everything that we can do. So anyway, we appreciate your support. I feel like we're just tied at the hip with the chamber and the city, and we're, again, so grateful for all that you do and happy to support in any way as well.
Any other questions? Peter, unmute yourself, Peter. Are you trying to say something?
Yes.
There you go. Okay.
Okay. Hi, Rick. Pete McDonald. If you close your skilled nursing facility and other people also close their skilled nursing facilities because of concern about becoming infections getting in there, is there a possibility that we're going to wind up with a serious shortage of skilled nursing beds?
Good question. At this moment in time, there is not a shortage in our region, which was a major consideration of ours. And in fact, one of the things that we are doing, and Tracy is leading this effort on our behalf, is working actually closely with the state and the county to work directly with our skilled nursing facilities in the region on their infection control protocols. So partnering very closely with those that we work with to ensure that their protocols, their processes, their training, all of those kinds of things are elevated is something that we're engaging with as well. So I think it's something we're keeping an eye on. I'm not overly concerned about losing skilled nursing beds outside of what we just discussed. But I do think we are looking for alternative ways to support that industry. I'll tell you, with the focus on it right now, while it's a challenge, I think for the skilled nursing industry at large, this is probably useful in terms of hopefully they will get more resources than they have in the past, because they're such a critical part of the care continuum. And I think that the government has realized that as part of this pandemic. And so hopefully between partnership with hospitals, partnership with government agencies and otherwise, we'll continue to be able to strengthen those that are in our community. And we have, just for the record, we have some really good ones here in our region. And so I think we're excited to continue to work with and partner with them.
Good.
I think we've sort of reached the end of our time. So I know we probably have questions, but Rick, I can't thank you enough. And also want to thank Tracy Lewis-Taylor while she's here for all her support and for you supporting her being involved with our board. She is just very valuable and we really enjoy working with her. So thank you for this talk. It was just really, really good. And we will spread the word that you're open for business. So that's
and we'll do the same. I mean, as this county stuff continues to evolve, again, we want to be very supportive of our business community. You mentioned, I mean, we're so glad that Tracy is so engaged with the chamber. We'll continue to find ways to support the work that you do. It's so essential. So thank you.
All right. Thank you, everybody. I'm going to sign us off, Lori, unless you have any last comments. You're good? Okay. Have a great rest of your week. Okay.
Take care.
Bye-bye.
Bye.